The knee joint is the most complex joint in the body due to its many bony, accessory, and musculature structures. These structures work together to stabilize the joint during flexion, extension, internal, and external rotation. Within the joint, the articulation between the femur and the tibia is cushioned by a medial and lateral meniscus. These will stabilize and tighten the joint as well as distribute synovial fluid and absorb shock. The medial meniscus is tightly secured to the tibia and the medial collateral ligament and is therefore more prone to injury than the lateral meniscus. We will now test the dermatomes for the root levels L1 to S2 on the lower extremity. L1, L2, L3, L4, L5, S1, and S2. Now we will be testing the myotomes for the L1, L2 levels as well as the S2 levels. L1 can be tested by having the patient flex the hip and keep the leg flexed. We'll apply slight pressure and have the patient resist. You will also have the patient resist my pressure as they're in a flex position, and then you will have them extend and have them resist pressure there as well. Now we will test the deep tendon reflex at the patellar. So the patellar reflex. The first test to test the integrity of the meniscus will be the Thessaly test. For the Thessaly test, you will have the patient stand on one leg and flex the other leg. You'll have the patient internally and externally rotate 3 times. Any pain while internally rotating could mean that the medial meniscus could be damaged. Any pain while externally rotating could mean that the lateral meniscus could be damaged. The second test is the McMurray's test. You'll have the patient begin in a supine position. You will have them flex the hip and flex the knee while you place one hand at the ankle joint and one at the knee joint. You will passively, externally, and internally rotate the leg. While externally rotating, you will apply valgus stress to test the medial menisci integrity. And then while externally rotating, you will apply varus stress to test the lateral menisci. Any pain while palpating or rotating could indicate a meniscal pathology.